First of all, thanks for the invitation. And I am Dimitris Tsikerdis. I'm head of the Development Department of Primary Healthcare Directorate of IDICA. And today I will present you the ORION. It's a high-level presentation of the overview of the project. The ORION Joint Action is funded in response to the flagship number 9 of the European Beating Cancer Plan, EBCP, which defines that the European Commission will establish a cancer inequality registry to identify trends, disparities, and inequalities in cancer prevention and care within European member states and regions. At the right, you can see an overview of the EBCP. So what is the ORION Joint Action? It's an initiative aiming to address cancer prevention and care disparities within the EU. The aim of the ORION Joint Action is to make available mainly qualitative analysis of the national cancer control situation in the European member states, including the state of play of implementation of the EBCP at national level, as well as to make available data insights on socioeconomic inequalities to complement and enhance the analysis from the Cancer Inequalities Registry. Some numbers, its duration is 2 years. The leader is the Slovenian National Institute of Public Health. We have 23 partners from 17 countries. The total budget is 1.2 million and the European contribution is about 1 million. Our primary target group are policymakers from member states and their representatives, and the secondary target group are EU organizations, experts, patient advocates and representatives, as well as patients from across Europe. The beneficiaries are citizens and patients from all European countries because together with the Cancer Inequalities Registry, the joint action will contribute to reducing measurable disparities in cancer prevention and care across the EU. These are the countries, and we have 5 objectives, 3 general objectives and 2 specific. The 3 general objectives are monitoring of the EBCP uptake and implementation, piloting on the EBCP monitoring and evaluation framework, maximizing the impact, and the 2 specific objectives are to support the monitoring and analysis of the implementation of the EBCP and to carry out an analysis of the state of play of national cancer control programs with special focus on the inequalities. So the work packages are designed in a way to meet the objectives that mentioned before. We have 3 horizontal work packages provided by Slovenia, IDICA, and Greece and Croatia, and 2 core packages by Belgium and Slovenia. The work packages are work package 1, which is the coordination, 2 dissemination, the work package 3 is evaluation, work package 4 sustainability and implementation support to the monitoring and analysis of the implementation of the EBCP, and the work package 5 analysis of the development in NCCP according to the flagship and priorities and actions that are adjusted by the EBCP. All this structure will ensure that all the other related initiatives in the EU cancer control domain are closely aligned with the ORION outputs and outcomes. So I will be brief. The first work package is about the coordination. It is coordinated by the Slovenian National Institute, and its main objective to ensure that the ORION joint action achieves its general and specific objectives. The deliverable about the technical and financial policy was submitted in April 2024. The dissemination working package, where the leader is Greece, is IDICA. It has the objective to this work package in the project communication and the public disclosure of the project result. We will see that in detail further. The work package 3 is implemented by the Public Health Institute of Croatia. The main objective is to evaluate the implementation of the ORION joint action and assess the achievement of its planned objectives. The deliverables related to the evaluation strategy and the interim report were submitted in the December 2024. The work package 4, led by Belgium Public Health Institute, is to monitor and adopt the implementation of the EBCP across the EU member states, identifying remaining actions, information gaps and opportunities for mutual learning, and to test the monitoring and evaluation framework, and to maximize the impact of the knowledge and evidence generated by the plan and explore the role of advanced digital solutions. Until now, the milestones that have been achieved in this working package is to review all the applicable monitoring framework for the adoption of the European Cancer Plan. The DELF exercise began in the autumn with the participation of all ORION partners and experts, and it was completed in the December of 2024. And a foresight study of the role of the digital innovation in supporting the use of evidence by cancer policy makers is to be completed soon. For the work package 5, which is coordinated by the National Institute of Public Health of Slovenia, has two main objects, the analysis of national cancer control programs and the formulation of policy recommendations. The main objective is to pave the way for the improvement of the quality of the NCCPs with special focus in cancer inequalities. The tasks are to map the current state of national control programs with a focus on cancer inequalities and how this will be addressed in these programs, and to propose actions to improve the quality of the national cancer control programs, emphasizing cancer inequalities. We have three milestones so far: integration of the equity monitor tool, preparation, a survey of the national cancer control program, and the collection of the response of this service that was conducted. By the end of August 2024, 34 countries completed the survey with a very high response rate. And considering the number of countries envisaged in the ORION joint program, the response rate was 100%. So we're very happy about that. As far as the working package 2 deliverables that we in IDICA are the leaders, we have 4 deliverables: the dissemination and communication plan, the interim report, final report at the project website, and leaflet. For the first deliverable, we had the dissemination and communication plan with aim to transfer project knowledge and results to the stakeholders in a way to inform, promote, and engage relevant bodies on how to take advantage of the results of this project, communicate information and scientific knowledge and the joint action results to policymakers, and bring together audiences to interact and establish a forum to promote the dialogue around the potential and the benefits of this registry development. So for the deliverable D.4, we have a web service, a website online to provide information about the project and its objective. It also hosts a forum to support the debate about the potential benefits of this registry development. And we have a leaflet as a digital promotion material, including providing an overview of the project to be used in various contexts to disseminate the information about the project and its objectives. Currently, you have the interim report highlighting the progress, achievement, and challenges of the communication and dissemination efforts undertaken under the ORION joint action, and currently have preparations to organize a webinar for stakeholders and an in-person forum at the European level in Brussels. So to conclude, the purpose of the ORION joint action is to contribute to the innovations and benefits for citizens of all European countries and for patients. It will provide recommendations to support monitoring of the EBCB, and the anticipated impact of the ORION is the reduction of measurable inequalities in cancer prevention and care across the EU. So feel free to visit the ORION website at any time. It has very useful information and details about the project, and we try to update it. You are welcome to follow the ORION profiles in the LinkedIn and in X. So please follow us so as to know all the latest news and events about the project. Thank you for your attention.